Hi guys, it's Dr. Brandy Rose Lipscomb, and it's been a little while. I took a temporary hiatus when I moved out to this little piece of paradise that you see behind me, and then I got really busy in private practice and some other things, and it's turned into like a year since I've made a video. Thanks for being a subscriber. If you're not a subscriber yet, you're welcome to be one. Today we're going to be talking about testosterone, the myths behind this amazing hormone that is not just for men. So most of my previous content has really been focused on pain relief. And I have to say that testosterone is also related to pain relief because testosterone is often really deficient in people with chronic pain. So if you are struggling with pain or maybe feeling fatigued or you're in that range, it's typically in the early to mid 40s when we start to see testosterone decline in women. You know, if you're wondering whether or not your hormones are imbalance or if your hormones need to be checked, I really encourage you to go to your doctor and ask them to check all of your hormones, meaning a really good thyroid panel. To me, that's TSH, free T3, free T4, and a TPO. Those thyroid autoantibodies are really important. As well as if you're menstruating female, typically day 21 is the best day to get those hormones at their peak: estradiol, progesterone, and your total testosterone. Those are three hormones that I look at in just about every woman who comes through my door. And if you're in the perimenopausal range, then I would also add an FSH. If you are menopausal, and we're talking about what we're going to share today, I would recommend adding that FSH on as well. And I'll share why in the next few videos, because for the next few weeks, we are going to talk about hormones, baby. So when I was first trained in medical school to prescribe bioidentical hormones as a naturopathic doctor, I was mostly focused on women need estrogen and progesterone. And oh yes, sometimes women might feel a little bit better on some testosterone, so you could give her a little cream, why not? And that was it. That was the end of the story. That was, 20 years ago almost. So in the past 10 to 15 years, we've really started to become more aware of the benefits of testosterone in women. And so today I want to share with you 5 myths about testosterone. I recently went to Dallas, Texas for a 3-day practical on pellet therapy. What is pellet therapy? That is taking bioidentical forms of hormones, estrogen and testosterone, or testosterone alone, in pellet form, and we insert them into the subcutaneous tissue, usually over the glutes, over the butt cheek. And what's beautiful about that is that a woman or man gets this steady state of hormones that lasts for 3.5 to 4 months for women, 5 months for men. And instead of the ups and downs of taking hormones by cream or by pill, you get this amazing, beautiful, steady state of so many benefits. And it was while I was taking this course that a lot of light bulbs really came on in my brain about all of the benefits of testosterone for women. So let's dive right in to the 5 myths about testosterone. Number 1 is that testosterone is a man's hormone. The receptor site for testosterone is on the X chromosome. That's right. If it was a man's hormone, it would be on the Y chromosome, right? And women wouldn't have any need for it. But women actually produce more testosterone throughout their lives than they do estrogen. And it is the first hormone that really starts to decline in a woman as she ages. From age 25 to age 40, a woman's testosterone production decreases by about 50%, which is huge when it comes to our energy and our libido and our mood and our ability to think clearly. Myth number 2 is, well, I'm over 55 and I'm through menopause, so I don't need hormones. Well, one of the benefits of testosterone especially in pellet therapy, this is only from pellet therapy, that it can help, along with some estrogen, reverse osteopenia and osteoporosis. Hormone pellet therapy can actually improve our bone density by 8.3% per year. That's mind-blowing, you guys, and so much better for you than the bisphosphonates. The side effects of testosterone therapy include improved muscle mass, reduced obesity around the midline, improved sleep, improved energy, enhanced cognitive performance. You get all of that and stronger bones. Where do we sign up, right? Would I put a 72-year-old woman on testosterone? You bet I would. Is someone ever too old to feel good? The third myth about testosterone. Testosterone's going to make me grow a beard, right? Wrong. So if testosterone is converted to something called DHT, dihydrotestosterone, it can have what we call a virilizing effect. That means that you could see a bit of a mustache, a few more chin hairs. However, in our practice, we know how to look at the algorithms and figure out just how much testosterone a woman needs to get the benefits and feel good, but not have all of the harmful side effects like growing unwanted facial hair. And if someone did start to grow some unwanted facial hair, there are ways to prevent the testosterone from becoming dihydrotestosterone, and that includes spironolactone, which is a prescription drug, and saw palmetto pygeum-based products, which are typically marketed for prostate health because they block testosterone from becoming the ugly testosterone DHT. Myth number 4 about testosterone is that testosterone is going to cause me to bulk up and I'm going to look like a bodybuilder. Testosterone does increase protein synthesis and decreases protein catabolism or protein breakdown, muscle loss. So when you do work out, when your testosterone has been optimized, you are going to start to see more of the benefit. We can build our muscle mass to have more of a fat burning factory and be more efficient at burning extra calories. So it is possible to gain muscle mass with bioidentical testosterone, but it is not the same as injecting synthetic testosterone or steroids. This is something that is going to help increase your lean muscle mass, not cause you to bulk up and look like the Incredible Hulk. And myth number 5 is that testosterone will make me angry and full of rage. Wrong again. So testosterone actually helps most women feel more alive, more sensual, more relaxed, more of a feeling of, I've got this, instead of feeling angry and raged. We get irritable when we don't feel like we can handle life, when we feel overwhelmed by things. That's usually what sparks anxiety. Testosterone therapy has been effective for PTSD as well as anxiety, and it helps improve sleep. So I hope you realize that the idea that testosterone is going to make you crazy it couldn't be further from the truth. I have never felt better in my life than I do having pellet therapy in my life. Before we wrap this up, there's one more myth that I really want to dispel for you, and that is the myth that hormones cause breast cancer. So the study that was done by the Women's Health Initiative that said that hormones can cause breast cancer was specifically the pregnant mare urine, the Premarin, that was causing increased risks of breast cancer. The pure bioidentical estradiol group actually had less risk of breast cancer over time. And with testosterone, most recent research is coming out that testosterone further protects a woman against breast cancer. So the idea that using pellet therapy would give someone breast cancer is completely erroneous. If someone tries to tell you that, they have not looked at any research that's come out in the past decade. So are you interested in learning more about hormone pellet therapy or testosterone therapy and how it could benefit you, we at Essential Wellness in Arlington and Meridian Medicine in Seattle are happy to serve you. If you live out of state, you could contact one of our offices and see about coming to Seattle a few times a year to have your hormones managed. We are happy to work with out-of-state clients. And if you live in the state of Washington, super easy. One caveat is that pellet therapy is not covered by your insurance. Of course it's not, right? So this is a cash pay investment in your health. And if you're interested in finding out more, you can go to our websites. There's a link below in the description. And if you'd like to hear more on this topic, leave a comment below. Let me know. What do you think about testosterone therapy? Have you tried pellets? Have you tried creams? Have you tried something different? Let's talk about hormones, ladies and gentlemen. I am here for this. So thanks for watching, and I'll see you next time.